particular, anybody on a public program, want to make sure that that money actually gets to the people who need it, who deserve it. From bidding, the processes, HMOs bid for that, trying to make sure that that's competitive and transparent, that they get the bid, and that the care is actually provided. The legislative auditor went through and found that over a 6-month period, up to $231 million was spent on people who didn't qualify for it. So we've got so many people with such high need that can't get services, that we've got funds that are going to the wrong places. So one of the things that we wanted to make sure is that that we actually audit that to find out if the money is going to where it's going, if it's getting to the people who need it. That's really the bottom line, to make sure that if people have needs, we are spending the money that it gets there. So we've got some proposals out there that say that if an HMO is getting money every month to give to a family, that they should be able to provide that the family lives here and that they qualify for services. And if they live in another state, or they died, or they're not here, and that we're still providing checks, that money could go to people who actually need it. So that's one area that we're looking at to provide additional, so that the money actually goes to where it's supposed to be going, and that people who aren't qualified don't get it. If you live in another state, don't qualify, or are dead, you shouldn't be getting money that should be going to kids and people who are in need. So we want to make sure that we provide a higher degree of security that that money is actually getting to where it's supposed to go. And also that the HMOs can actually compete, show what their costs are. I think that that's a legitimate concern. We also allowed for-profit insurance companies to compete with them so that we have more competition, and more competition we hope will be able to provide a better value for them. So those are 3 areas that we're looking at.
Thank you. Would anyone else like to respond? Our next question is, please explain the federal Medicaid block grants or a per capita cap, which would be based on the number of Medicaid patients in a state. Are these a good or bad idea for the Minnesota Medicaid program? And that was directed at Lynn, and then if another legislator wanted to follow up, that'd be great. Thank you, Lynn.
Yeah, so Medicaid is set up as an entitlement program. So if you qualify, you get services. So you meet the income, whatever the state has for eligibility, you get services. And the state pays, and the federal government provides matching payments. So there's no cap or limit on the contribution of the federal government. It's an entitlement program. So as the rolls grow, the feds pay more and the state pays more. As it shrinks, they pay less. And so it's an entitlement program. Anybody who's eligible is entitled to that program, and the government pays for it. So under the proposals that were in the GOP proposals was to change that to a block grant kind of concept. So instead of being an entitlement, it would cap the amount either for a total amount of, you got this is how much you got in Medicaid last year. We're going to increase that, and the latest one was for CPI. We're going to give you a cost of living increase, and you'll have that much next year. Doesn't matter how much your rolls grow, how much the enrollment grows. It doesn't matter how much your costs grow. This is what you're going to get from the federal government. And so that creates a lot of pressure on the state legislature to figure out how are we going to stay within our budget. Because no longer is it, let's provide services, we have our state budget that we deal with, and the feds are going to match that. It's now, they're giving us a budget, we have to stay within that. So that, so you either do it on a total budget basis, or you could do it on a per capita, so by person, which would be a little more generous. But either way, it's a significant reduction in the federal contribution to the Medicaid program, with more pressure on the states to either increase revenue or more likely to reduce eligibility and benefits.
Would anyone else like to respond? Great.
I think, as long as I can remember as an adult, we've had this debate about block grants versus specificity, and it changes back. It's not just in healthcare. It's in a variety of things. And I think we heard a reference to, we'll just give the states more flexibility. So we'll just give you a block grant, we'll give you one check, and then you can decide how to do it. If we look around our country, we see a wide range of what states are doing. And we are still a country. I mean, we see that some states may just say, we're not going to do this. That our brothers and sisters that may be across the state line are going to be treated dramatically differently. And if you do the block grant to the state, then to the counties, you may see a dramatic difference between counties. It's not that much of a leap to say, well, we'll just block it out to the counties. We'll let them figure it out. We'll let, if you're in Washington County, you might be able to have help, but if you're in Dakota County, you're not. So what binds us together as Americans? What binds us together as Minnesotans? What binds us together as people? It sounds so seductive to say, we'll just give you the check. We'll just give you this flexibility. But what about the fairness in terms of having the coverage that you need wherever you are in this country if something is happening? Now, I understand cost containment and the need for that, but there's no guarantee with a block grant that you're going to have cost containment.
Thank you. Also, I believe in Minnesota, or well, actually nationally, we didn't have much of a mental health system, is my understanding, before when mental health was given as a flexible pot of money to states. So that's another area that we could talk extensively about. This is the final question. So what are your plans to replace the Medicaid expansion program for all of these people if the GOP repeals the ACA?
Is it based on disability or is it based on?
So what are your plans to replace the Medicaid expansion program? So for those low-income adults that didn't qualify for Medicaid previously, but who were able to access Medicaid, and these are the folks who are making roughly $9 an hour at the most. So very low-income adults. Does anybody have a response for that about what we would do to help ensure that population or to provide care?
Susie, I think that's a difficult question to answer. It's going to be about what are the taxpayers in Minnesota willing to swallow. And, with the block grants and this perspective, this is really, our tax burden to Washington, D.C. isn't going to go down. They're still going to take our money. And they're not going to be on the hook to help us back if that's the case. And so that is the concern about what is it when you put it back on the states and then we'll push it back on the counties. Yeah, I can guarantee you the counties are going to have to raise revenue to cover some of the costs. And then are we going to be moving people to a different program like Minnesota Care or whatever else may be involved in more of a state-based program? So we have a lot of difficult choices that would come with that, and they are not going to be free. So let's hope this doesn't happen so that we're not put into that position.
Susie, I would just add that, I thought a lot about this, like if these bills were to pass, which it looks like maybe they won't, but Minnesota would actually go back, we would go back to worse than we were pre-ACA. We would go back even further, but I haven't figured out how far we would go back. But the problem is, we won't have the Minnesota Care program anymore. So that used to be funded by a 2% provider tax that was put into a fund to fund Minnesota Care and other access programs. And so those funds are almost gone. And that tax is repealed, it'll be done at the end of 2019. And so we don't have that resource to refinance the old Minnesota Care program, which was, passed bipartisanly and established in 1976. So it's like, unless the legislature said we want to finance the Minnesota Care program with a different source of funds or reinstate the provider tax. So it's in some ways it was great to have the federal government come in and say we're going to pay for this, and it relieved the burden on Minnesota taxpayers. But now if they take it away, we don't have the resources to do that program again. So that's my concern, is that we go not back just pre-ACA, which where a lot of states will go back, but we'll go farther back.
Thank you so much to everyone for your comments and to everyone for coming here tonight. I just need to point out we have 11 elected officials and they kept it in the time and we are ending on time, which is amazing. Sorry,
We
Senator
have
Schultz.
12, and I want to recognize
Oh.
Hastings Councilmember Tina Fulch.
Oh,
In the
snuck
back
in.
of the room joined us during the meeting as well, too.
Oh, fantastic. Thank you so much. So 2 things. If you sat through this presentation tonight and either you knew a lot about Medicaid when you came in, or now you know a little more, or you heard the stories from Rosie and Brian and Kate and Jamie, and you feel compelled to act, there was a postcard on your seat. Feel free to fill it out, make sure to put your address on it, and leave it at the table on your way out. We will deliver that to your member of Congress. As Lynn said, and we've said several times, it appears that these bills are not going anywhere, but as we know, they can reappear again without a ton of notice. So we want to be able to make sure that your member of Congress knows what you think about Medicaid. Second, as you leave, Alicia and Beth out there at the table have a postcard that looks like this. On this side is our contact information. You can sign up for our emails, follow us on social media to stay up to date on what we're up to. And on the other side is your member of Congress's phone number, so you can call and let him know what you think about Medicaid as well. I just want to say thank you so much to each and every one of you for spending your evening here with us, to the folks, the elected officials that came out to be with us, and to the folks that shared their stories. Thank you so much, and safe travels, everyone.